Early detection saves lives. Join Dr. Muralidhar Beeram, medical oncologist at the Start Cancer Center in San Antonio, Texas, as he shares his valuable insights on the critical importance of early cancer detection and preventive measures for a healthier future. Presented to you by Diagnostic BioSystems as a part of our commitment and initiative to raise awareness about cancer.
Hello, I'm Dr. Muralidhar Beeram. I'm a practicing medical oncologist at the Start Cancer Center in San Antonio, Texas. Today, I would like to briefly talk about cancer diagnostics, early detection and prevention, and the impact of this disease on the community at large. If you take cancer as a chronic disease, the biggest impact that cancer can have is on the individuals, the families, and the social structure at large. And the impact of this disease can be minimized by having a strong screening program and early detection of cancer. The stress being on early detection, because you can actually have major instances of cure when a cancer is detected early in its disease course, and curative and preventive therapies are offered. With regards to prevention, there are different programs of prevention that have been put forth by the American Cancer Society, and I will list some of them for you today. For breast cancer specifically, the screening program suggested is that all women should start having mammograms at age 45 and then once every 2 years thereafter for up to the age of 75 years. The intent of this program is to capture the cancers early so that if they are diagnosed at either a precancerous stage or as an invasive cancer, that they can be curatively treated. Switching gears slightly, let me briefly speak about lung cancer, which is one of the most commonly diagnosed cancers in both men and women. In patients who smoke more than a pack of cigarettes per day for 20 years, the risk of lung cancer goes up significantly. And in these people who are either currently smoking or who have discontinued smoking in the last 15 years, the recommended screening protocol is to do a low-dose CT scan of the chest starting at age 50 and as needed, possibly once every 2 to 3 years for up to the age of 80 years. This can help significantly diagnose early-stage lung cancers, which can be treated with a curative intent, and as such, people will live normal quality of life and normal longevity of life if the cancer is cured. Third cancer that I would like to briefly discuss is colon cancer, where the screening protocol involves a screening colonoscopy to start at age 45. And then these colonoscopies are repeated once every 5 to 10 years, depending on the features identified in the first colonoscopy. If people have higher familial risk for colon cancer based on existence of polyps or other features, then the frequency may be shorter in duration than once every 5 to 10 years. Patients with cervical cancer screening, especially women with cervical cancer screening, the protocol requires starting the screening process at age 25 and then performing a HPV DNA test at age 25 and every 5 years thereafter. Women can also choose to undergo a immunohistochemistry assay and a pap smear concurrently. It is a co-testing that can be performed every 5 years through the age of 65 years. Talking a little about skin cancers, which are not a big instance in India per se, but is a big issue in Western countries. The recommended screening protocol is to look at the entirety of the skin by a trained dermatologist at least once a year and to biopsy any suspicious lesion that is identified during this process so as to enable early detection. Lastly, let me briefly talk about prostate cancer, which is the second most commonly diagnosed cancer in men. The recommended screening protocol for prostate cancer is that men should undergo a digital rectal exam and PSA testing starting at age 50. There may be instances of patients who have a higher risk for prostate cancer in the family where the cancer screening needs to start at age 45. It is important to note that PSA alone is not adequate to diagnose prostate cancer because you may have prostate cancer even with a PSA of less than 4 nanograms per ml, and you may not have prostate cancer even with significantly elevated PSAs. So the important aspect of this disease is to undergo the digital rectal exam, and if you are found to have abnormal findings, to then undergo an ultrasound guided biopsy of the prostate gland itself. With regards to cancer diagnosis, it is important to know that most cancers today diagnosed in stage 1 or stage 2 of disease are treated with an intent for a cure. So what I'm trying to convey is that the diagnosis of cancer does not always mean that it is a death sentence. Most cancers diagnosed in stage 1 and stage 2 of disease are treated with a curative intent, and that is the reason for why the screening protocols are so important. While low cost, they can significantly improve the overall cancer burden for the society, where people do not need to undergo long-term treatments which are mandated if you are diagnosed with advanced stage cancer. So please make an attempt to get screened regularly as required to make sure that if there is a cancer to happen, it is diagnosed at an early stage where you can be treated curatively and you can live a long, regular life without having a burden of cancer hanging on you. Lastly, for those patients who are diagnosed with advanced stage cancers, the concept of cancer is changing as a disease. We need to think of this as a chronic disease, somewhat like a diabetes or a hypertension. And the intent of treatment for an advanced stage cancer is to suppress the symptoms and enable patients to live longer, where they may have more productive lives that are significantly longer than what they would be if they were left untreated. So advanced stage cancers need to be treated. There are very effective therapies that are available today and that can significantly have an impact on overall longevity for the patients and their quality of life for the patient as an individual and for the family. Thank you.